Welcome to the Bennington News and Information. I'm Marc Miele, Marketing and Coordinator for the Bennington Area VNA and Hospice, also known as BAVNAH. In October of 2014, BAVNAH was purchased by the Rutland Area VNA and Hospice. While we are no longer part of SMVC, we still work collaboratively with the hospital to offer the highest quality care to individuals in Bennington County. BAVNAH is a local Medicare certified home health and hospice agency. What that means is we are certified by Medicare to provide health services to individuals in their own home. We are a nonprofit VNA and hospice serving Bennington County. How does that differ? Well, BAVNAH is governed by a volunteer board of directors, and the money received goes right back into the programs offered to the community. Our services include nursing, therapy, social work, hospice, and community clinics, all of which help keep patients safe and comfortable in their own homes. This is a series of shows which will inform you of upcoming events, clinics, health news, and information that BAVNAH has to offer the community. With us today is our Community and Occupational Health Manager, Kathleen Paulin. Thank you for coming.
Thank you for having me.
So I know your job keeps you very busy as you're in charge of running many clinics. And today we're going to focus primarily on blood pressure, cholesterol, and foot care.
Yep.
So tell me a little bit about that.
Well, in Rutland we have our foot clinics. Those are one of the real big sellers up there. We go to various towns and provide foot care to the community. It's beneficial to them in part because not everybody gets a podiatrist included in their insurance. You have to have a medical diagnosis to support that. So if you don't have that in your insurance, you have to pay for it, which can be $70 or more. So people will come to our clinics, and for $10, they'll come in and have foot care provided to them by registered nurses.
Oh, that's fantastic. Well, who staffs the clinics?
All of the nurses are working for the Community Occupational Health Office. They're all registered nurses. We go out and offer our services, and we do have volunteers sometimes asking if they can, help out by setting up or things like that. But the services themselves are by registered nurses.
Oh, fantastic. Okay. Well, so people are definitely getting the care that they need then when they come in. What kind of foot care do we provide at the clinics? I mean, is there a specific kind? Do we just only go so far, or how does that work?
What you can expect is when you come in, we help you remove your shoes and your socks, and we do a quick check from basically the knee down to the toes. We check for circulation, condition of skin, any possible injuries or wounds or things that might cause health issues. And while we're doing that, we're kind of assessing what else is going on in their lives, because that can have a direct impact on their feet and their circulation. And then we clean around the nails and trim them and file them and give them some basic tips on things that they should look for, do to promote good healthy feet. And we'll apply lotion at the end with a little massage if you want.
Sounds great. How do I sign up for this?
Just show up. They're all walk-in.
Well, what are some of the common things that you see during the clinics?
We've pretty much seen everything. Feet are a real personal thing, and a lot of people kind of hide their feet. They're ashamed of their feet. They don't like people looking at their feet, let alone touching them. So coming to a foot clinic can be a little daunting to some people. And in our elderly community, the toes often get missed. They can't bend over to reach them. They don't have the hand strength or the agility. They may have had hip and knee replacements, so they're not supposed to bend to a certain angle. So their toes get forgotten. And we'll have people that have come in and not had any foot care done for, several months. So their toenails are quite long, and most likely they've actually increased their shoe size because of it. So we see everything: corns, bunions, dry skin, calluses, cracked skin, ingrown toenails, you name it, we've seen it. Nothing really shocks us. I actually, at one of my foot clinics that I did, had a man come in, had been visiting his daughter from Florida, and she was very concerned because they were taking a road trip, and when she'd seen his toes, she knew he hadn't had them taken care of in some time. So she apologized for the condition of his feet, and as I took his shoe off, she was telling me, his big toe is kind of loose. I'm not really quite sure what to make of that. And as I pulled his shoe off, his toenail fell off. because it was so loose and there was a lot of debris under it. And so we've seen everything, literally everything. And that's a good starting point for us to, start looking at what medications do you take, what other health issues do you have, because all of those things have a direct impact with your feet.
Right, because sometimes people just don't know too. If they get to a certain point where they're having a little bit of trouble with a toenail, they don't really know that, oh, there's something out there that I could be doing to better help this, whether it's change in diet or change in medication or something to that effect. But that's where the nurses come into play. And I've seen a lot of people who have hammer toe. And I mean, that just looks so painful, and for people who don't know what hammer toe is, it's when your toes actually start to curl and the toenails start to grow out, and then you can get calluses underneath them, and it's incredibly
It's almost
painful.
like the joint is kind of pushed up.
Yes.
It does look uncomfortable, and for some people it is, but other people get adjustments made to their shoes or only buy a certain kind to accommodate the change in the joint. So we have seen those things, and we again offer different solutions that they could try. And certainly if we are ever concerned, we will let them know. We'll contact their physician, or we could make a referral to a local podiatrist, if they don't have one that they've ever seen. We do have to assess whether or not it is okay to cut their toenails. We very, very rarely will turn someone away. And the few that we do, we educate them why we're doing it. Their toes may be in such poor shape. They may be a diabetic, and when they take their shoes off, their toes are black and cold. We don't want to risk causing injury or, infection. So we'll let them know we really need to get you in to see somebody else. And, then they can come back when their toes are a little bit more manageable. So we really try to reach out and let people know that you have to keep after your feet. Your feet are basically telling a story.
Exactly.
And if you don't know what to look for, you don't know that there's a problem.
And that's even not to say that if somebody has diabetes and they're ashamed of the way that their feet look, that they can't still come to you and just say, I'm concerned, I'm not sure what to do, what do I do from here? And at that point, that's when you would step in and say, I can do this today, but really you should be looking to go see this person or this specialist. But, that way people don't have to feel ashamed to come in and show their feet.
And typically people that have Medicare and Medicaid, if you have some type of a lower extremity circulation issue, if you're on Coumadin, if you have what they call PVD, which is peripheral vascular disease, if you have diabetes, a podiatrist visit usually is included in your insurance, and you should at least once a year go and see a podiatrist for a full assessment and check, just to make sure everything is okay. The big risk for those is that the circulation has been altered. So if you get an injury in your foot, it can take a very long time to heal, or it might not heal before you get an infection. And then again, because the circulation is an issue, it's having a harder time healing from the infection because the blood circulation is not there. It can't get down and take care of it. So it can be very complex.
Well, what are some of the things that people can do prior to coming in? Is there anything that they should do in preparation from coming in, or is it just, come as you are and this is what my foot looks like?
We will take anybody in any condition that they come in. We have people that apologize because they haven't soaked their feet, or they have a hard time reaching their feet, so they're not the cleanest because they can't reach down to clean them when they're bathing. But what we tell people is, come, no matter what. We'll do what we can. We'll clean between your toes while you're there if we need to. But if you have that opportunity to soak your feet, don't soak them too long. A lot of people think soaking them for 10 to 15 minutes is a good idea, and what can actually happen is it over softens the nail, and it can make it more difficult to give it a good clean cut. It can actually tear it, and then it can go down below the cuticle line, and then you can get a potential ingrown toenail and yada yada yada. So
and then they come back to see you again.
So a lot of people will just come. They haven't done anything to their feet. We'll clean with a little bit of alcohol between their toes, which is really great if you have really moist, wet web spaces between your toes. That'll help dry it a little bit. We'll clean the toe itself, get a good look at what's going on, and then we'll proceed with the care. So you don't have to do anything to come and You just have to come. You have to be willing to bring your feet in.
And well, what are some of the things that people can do between clinics? I'm assuming, you know, we just talked about the nurses will give you some directions and things like that, or instructions as to what to do. And everybody's different, so everyone's going to have, you know, a different level of foot care. But what are some of the things that people can do between the clinics to help keep them going?
We encourage people to look at their feet every day. Feet can be a difficult thing to look at if you can't bring your knee up to your chest.
Yeah.
So one of the tricks that we teach people is get a mirror, put some magnets on it, stick it on your washer, your dryer, your refrigerator, your stove, lift your foot up in a chair in front of it, and you can see the bottom of your foot. Or put it on the floor. So checking your feet at least once a day. It's best to check it in the morning and again in the evening, because then if it's good in the morning and then in the evening you see some type of a mark that wasn't there, you know something's occurred. You might have gotten a pebble in your shoe and not realized it.
Right.
So you'll want to go and check your shoes out. Maybe it was a new pair of shoes and they're not the best fitting. So it's good to check them in the morning and then check them again in the evening. You should definitely keep the web spaces between your toes dry. If you can't reach your toes, they do have tools that you can get at some of the medical supply stores. It's basically a long wire with a little square at the bottom, and it has a little terry cloth like cloth that's like a little purse, and you tie it on and you can kind of rub it between your toes. I've had people use rubber coated kitchen tongs to hold like a small cotton ball to reach between their toes if they can't bend. So you can get creative, but you want to make sure that if you're cleaning between your toes, you're not putting anything sharp between them. You want it either rubber coated or dull so that you don't accidentally poke it.
Right.
Alcohol is a great thing. Just rubbing alcohol on a little cotton ball or a piece of gauze or even a washcloth, and you can do like the shoe shine polish motion. Will dry web spaces. So if your toes are white and macerated and soft tissue and there's always skin coming out of them, your feet may sweat a lot, or your shoes may be trapping your body heat. And that can lead to infections and fungal infections, and so it's good to keep them dry. So if you have that problem, you should do that once a day. We tell people cornstarch or a dusting with a talc is good for your feet, but it's literally a dusting. We have people come in and it actually gets caked up in their feet because they're using too much. So again, just a puff ball or a cotton ball, kind of rub it around in a little cup or dish to get just enough powder and just kind of hit it against your toes very lightly. That's the amount of powder you need. You do want to be careful using certain powders because you can actually promote a fungal growth. So it is good to just use a talc, a basic talc with no medication in it or anything like that. Cornstarch can actually promote some people, foot problems because it attracts bacteria and funguses and helps it to grow. If your skin is dry and you see any little white lines or cracks on your legs or the tops of your feet, you really should try to lotion them. Lotioning can be quite an education in and of itself. When you go to the store and there's an entire aisle of lotion, you want to try to find the ones that are very, very thick. You want more of what they call a cream. So it comes either in a tube. You can get them in the pump. Gold Bond has one. Walmart makes a brand that's very similar to it, but it's very, very thick. Those don't tend to have alcohol in them, so it doesn't dry your foot out further. So then you don't end up having more dry skin issues. So, you know, lotioning them once or twice a day. If it has the vitamin A, B, D, aloe, those are all okay things to have in the lotion. But if it says for dry skin and your feet are dry and you have a lot of calluses, that's the lotion to pick.
And I would assume too that during one of the foot clinics as well, that if somebody does have dry skin and they're having a hard time reaching their toes as it is, not only would the nurses show them how to apply it, but then also how to put their socks or stockings back on. So that way, you know, they're not wiping off
all the lotion
before they get their socks back on, and in an easier way.
It is better to take a smaller amount of lotion and put it on multiple times in the day. If you're older and you have swelling in your feet or edema where your shoe kind of cuts in, or when you're taking your sock off, you can tell the pattern of the sock or where the elastic started or ended. You have swelling in your feet. For those people, you know, taking your shoes off a couple times a day is actually good for your foot because it releases that tension so the circulation can flow better. So it is good if you have dry skin to put the lotion on multiple times a day rather than gobbing on so much that then your feet are slippery and the lotion doesn't actually get absorbed. If you're soaking your feet, again, just a 5-minute soak is good. Some people will put things in the water. If you're using any types of lotions or oils in the water to help promote the moisture to your foot, just be cautious standing up. Make sure you're sitting and drying, because you don't want a slippery foot and then to fall.
What about soaking in Epsom salts? Because I hear people, and I don't know, but I hear a lot of people saying I soak in Epsom salts, either if it's in a bath or just, to soak my feet. Is that something that is okay?
It's perfectly okay. It's safe to do. Follow the instructions that are on the container. You don't want to overuse the amount of Epsom salt compared to water. You want the right dilution. And again, usually it's a 5-minute soak, but it's very relaxing to the foot. So we forget our feet. We take care of a lot of other things, but we tend to forget our feet.
Yes.
Until
they start to hurt, and then you're like, okay, there's something going on here.
Check your feet, with a mirror. If you can't reach your feet to dry them well, you could use a hair dryer. You want to make sure before you put your shoes and socks on that they're good and dry. You can use that shoe shine motion with a washcloth. If you have a hard time reaching your foot, you can put lotion on a cloth and kind of just rub it, or put it on the floor and kind of rub your foot back and forth on it. It'll absorb a little lotion.
Yeah.
Make sure when you buy your shoes that you are buying them more towards the afternoon or end of the day, because if your feet are swelling, you're going to get a shoe that fits you better.
Makes sense.
So, when you get your shoes, one of the things you should do is actually take the sole of the shoe and put it up against your foot and actually see if you can actually see the sole of the shoe outside of the shadow of your foot. If you can't, you're cramming your foot into a shoe that's too small, and it's just not good to do, especially as you get older.
Right.
So those are some of the things that we tell people to do.
Oh, good. Now, is it a good idea for the people to come back to the same clinics?
We have people that do it both ways. One of the benefits of going back to the same clinic is our clinics are typically operated by the same nurse or the same nurses, depending on the number of people we're serving. So if you go, they get to know your feet if your feet are problematic, and they can kind of judge whether or not are the things we've been telling you to try working, or do we need to tweak them a little bit. So it is good in that regard to go to the same places. If you have the thick toenails or the fungal toenails that peel when you're cutting them, it's nice to go back to that same person, because they kind of know. You might be one of those people that you have a slightly ingrown toenail or one that's changed shapes, and that particular nurse does know your feet a little bit better than someone who doesn't. But it doesn't mean you can't go to another clinic or have a fill-in nurse not be able to give you good care to your feet.
Yeah, so it's not a once and done thing. You can come as many times as you want to, and it's
and we have some people who like to come every month, but they go to 2 different clinics. Because some of our clinics are very small, we'll offer them every other month. And so we have people that like their toes done monthly, so they'll go to one place and then they'll go to another. Rupert and Dorset are an example of that. They're opposing months, and we'll have people go back and forth to each of them.
Oh, there you go.
So that way they're still done every month.
And I think you said this before, and I just will reiterate the fact that this is absolutely open to the public. There's no restrictions. You don't have to get a referral from your doctor. You can just kind of come in as you are and just say, here I am, Kathleen, what do you see? Help me out here.
The one thing we'll do is, if you do come in and you do have a circulation issue or diabetes, we'll still trim your toenails that day, but we'll ask you for your physician just to send the note to a physician, like an order, just saying, your patient has come to us, they're requesting us to do their foot care. Are you okay with that? So, we'll still provide that care, but we like to let that doctor know. I have yet to see a doctor say, you can't take care of my patient's feet. But we do that because the circulation issues can create problems.
And again, it's part of this is working collaboratively with everybody, with the doctors, and just to help people, get a little bit extra something, just to help with this specific case, foot care.
Yes.
Yep. Where can people go to find out about where the clinics are going to be held?
There's a couple things. We do post them in the local papers. For Rutland area, they are posted in the Rutland Herald, Sam's Good News. A couple of the towns have little papers, so we release it to them, and they'll put it out in their newsletters for their community places. You can go on our website. You can go on our Facebook site, and you can certainly call the office. The main number, the receptionist has the schedule for that month right there. If you need more information than that, or you need a mailing or something, she'll refer the call to me, and I will get it out to you guys as soon as possible.
And of course, the number for Bennington is 442-5502, and the website is www.bavnah.org. And as Kathleen just said, don't forget to like us on Facebook as well, because sometimes there's information on that can be helpful for people out there as well.
That's right.
So another curious question, how does going to a foot care clinic differ from going to a podiatrist?
We don't do diagnoses. That's one big thing that the doctors will do. If there is a major wound or something that looks like it's infected or not healing, if it needs medical treatments like a medication. Some people have really bad fungal infections in their toes, and it spreads from one toe to the next toe. And so often those things are good to go to the doctors for, because you need that doctor to give you that care or medication or provide that treatment. Whereas when you come into us, we do have toes that have a fungal infection, but they're not in such a state that the doctor feels they need to be treated. Fungal infections can be one of those things that can go untreated for a long, long time. It grows typically very slowly and typically is not an alarming thing when it's in the nails. But if we're alarmed, we send you to the doctor.
Right.
So, going to the podiatrist will give you one more step up for diagnosis and treatments, and coming to us is a good stopgap in between.
Right.
Or at least to be able to go, your foot really needs more attention than I can provide.
Right. Right. Well, that's good. I mean, it's like you say, it's good to work with the doctors in the community, just to give people a chance to get out, to just say, hey, I'm not really sure. What do you advise? Right.
The biggest benefit that we find is people love to come to the same clinics because they sit and visit with each other as they're waiting their turn to get in. Some of the sites have coffee and tea. So, it's a nice community social service for the people that come. It's a way for them to get out and socialize. Because the majority of our people are older, but we do have some younger people that don't take care of their feet. They have somebody else do it. So the youngest person I think I've seen was probably in their 30s. So, at any age, you're allowed to come. Doesn't matter. And then the only other thing is we hear from our people that come constantly, this is such a wonderful treatment. We're so grateful that you're doing this service for us.
Right.
And in part, it is the cost, because the majority of our people don't have that podiatry thing included in their insurance, so they have to pay cash out of pocket for that appointment, which, like I said, can be $70, whereas ours is a suggested donation of $10.
Right. So sometimes people could be, and I'm not sure, not saying this, but they might even be dissuaded from going to their podiatrist for fear of cost, whereas at least coming to a clinic for a suggested donation of $10, they could get, a registered nurse to look at their feet, to help do whatever needs to get done at that time. And then if the nurse feels, okay, you really, really do need to go see a podiatrist, that could be the catalyst for them to just say, okay, then, if Kathleen's telling me I need to go, I guess I really should pay attention to her and go.
Right.
Well, that's good. So moving forward with your busy schedule, you also do blood pressure screening.
Yes.
And so what does that entail? What are we looking at there?
Our blood pressure screenings are offered during the foot clinics. So we have a blood pressure cuff that we keep calibrated. We make sure that it is up to speed and up to date, so you can get an accurate read. So we're looking to make sure that people's medications are working, that they're taking their medications and it's having the right effect, that they're aware maybe they're dehydrated, that they're even aware that they have high blood pressure. You don't always have symptoms to know that you have high blood pressure, and it can be detrimental. It can lead to heart attacks and strokes. So, just knowing what your baseline is a good idea. And we like to think ours are a little more accurate than some of the machines that they have. Not all of them in pharmacies and places like Walmart are, not functioning well, but not sure how often they're calibrated. We know ours are. We know we apply the cuff in a proper position. We know that we get the person into the right state in order to take the blood pressure to get an accurate reading. There's tricks to taking blood pressure that a lot of people don't know. So those are some of the things, and we'll put it on a little wallet-sized card that you can take with you, so when you go to your doctor, you can show them, you know, when I'm not here and very nervous and having walked down the hall and waited 30 minutes for my appointment, so now my blood pressure is high, this is what it is.
Right.
So it's a good tracking record to understand, you know, is my blood pressure in check? Is my medication working? And you can keep track of it that way and then still share it with your physician.
Okay.
But certainly if we see something out of a whack, we'll let you know you got to go see your doctor.
Okay. Well, and real quickly, because I know that we're running out of time, just want to touch base, because I know I said it in the beginning, about cholesterol screening too. Is that something, what can people expect out of that as well?
We do offer cholesterol screenings. We're starting to try to open that up more in Bennington. Currently, it's at our Dorset office and our Rutland office. We offer them once a month. It's a $30 charge. It's a little tiny finger stick. We get the results within 5 minutes, and it gives you a good baseline as to where your cholesterol levels are. It tells you the good cholesterol from the bad cholesterol. It can tell you what your risk factor is. We do some basic counseling on nutrition and exercise and smoking, other heart problems or health issues that you have that could impact it. It's a good little baseline for people just to know. Sometimes labs are very expensive. A lot of people don't like to have a needle stuck in their arm. So it's a good way to just kind of know where you're at.
Right. And again, it's just something good that's offered to the community. Come as you are, no appointment necessary. Just look up as to where the clinic is going to be held, and then go from there. So with that, Kathleen, I want to thank you for coming and hanging out with me today. It's been my pleasure. I want to thank everybody for watching our show today. And again, if you have any questions at all, please feel free to call the Bennington office at 442-5502 or visit our website, www.bavnah.org, and like us on Facebook. Thank you very much, everybody, for watching, and stay tuned for our next episode.